to live a healthy life.
Yeah. Where does she get her information from? Do you watch TV
Your
with
children.
her?
And you're not wearing a mask at home. All of these things that we find in African Americans increase your susceptibility to getting the virus, especially this more contagious Delta virus. Right now, in hospitals throughout the country, but most certainly in the South,
What happens if it's positive?
do not want to take the risk. You need to ask those questions.
What made you come?
I came because I want to get vaccinated so me and my family won't have COVID.
Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome back to For Your Health. For the next couple of months, I'm going to be really focused on COVID-19 and COVID-19 vaccinations. We're starting a new series called COVID Conversations. And so I want you all to tune in on Saturdays at 1 o'clock. We'll be live streaming these conversations because I am concerned. There's a lot of misinformation out there. People are come up with all sorts of reasons why they don't want to take the vaccine. And some of the information that they have, they've gotten from Facebook, from Instagram, from Twitter, from TikTok. And so I want to come and bring the real information to you because this is important. You know, we've had over 600,000 people die of COVID-19 since this thing started. And a lot of those folks were African Americans. They were 2 to 5 times higher incidence of getting the bad effects of COVID-19. So they were hospitalized, and they're not here any longer. And right now, in July 2021, in certain places in this country, Georgia being one of them, we have this Delta variant. And so the statistic that I heard last week from the CDC and some of the other experts is that 97% of the people in this country that are hospitalized due to COVID are unvaccinated. That's the real story, folks. That's real data. So the people who are in the hospital right now, the folks that are on respirators, the hospitals are starting to fill up again, haven't gotten the vaccine. Now we know that there's this new variant, this Delta variant, and it's in certain pockets in the country. And we know about this Delta variant that it's more contagious than the original strain of COVID-19. And we know what viruses do is they mutate. So people who are unvaccinated, they're getting this Delta variant, and they're basically becoming human incubators for this virus. And this virus is inside their bodies, changing and mutating, and they might not even know that they got it. They might be one of these sort of asymptomatic carriers. But we do know that the folks that are in the hospital right now are sick. And if they had taken the vaccine, they wouldn't be in the hospital. So we know that vaccines do one thing for sure, no doubt about it. They make it so that you don't have the serious consequences of getting the infection. It decreases hospitalization by 90-something%. I mean, it's high. It also decreases your ability to contract and get the virus. So I'm encouraging everyone out there, except for a small subset of people, to get vaccinated. Right now in the country, we're averaging around high 60% in terms of people who have gotten at least one shot. And when you look at the African American community, that number is 9 to 12% in some places. So I am here in Clayton County, Georgia, trying to make a difference in the number of people who are vaccinated. We know that some of these folks that are in the hospital right now are children and adolescents, young people. We didn't see that last year. Very few young people were hospitalized. So this variant is very, very different than what we've seen before. It's gotten worse, not better. So I'm encouraging you to get vaccinated. I understand that a lot of you have varying reasons why you don't want to take the vaccination. And you think that if I continue to wear a mask and I continue to do my hand washing and I continue to keep my distance, that that's all I need to do. Well, let me tell you something, folks. I know this for a fact. There were folks who wore a mask last year, who used the hand sanitizer and washed their hands, who kept their distance, didn't go anywhere, and they still got the virus. And they still went to the hospital. I know that for a fact, because these were people that I know personally. So I understand that you think that that's all you're going to have to do. And I hear people say to me all the time, well, we're just going to be hyper vigilant for now. All right, not get vaccinated. Well, let me tell you something, folks. COVID-19 probably not going away. It's a virus, just like the flu. The flu doesn't go away. We get the flu every year. And sometimes the virus has mutated and changed. So the flu vaccine has to be changed in order to basically work on that particular strain of the influenza virus. So listen, this is our first COVID conversation with Dr. Xavier Bryant. Dr. Xavier Bryant is a pharmacist. He also is a pharmacy entrepreneur. He has been doing pop-up COVID-19 testing and vaccination for the last 6 to 8 months. And he is going to tell you what he knows, not what he thinks he knows, because he's actually been doing this thing. So thanks for tuning in to For Your Health. Please hold on, because we're about to have a COVID conference. Hi, I'm Dr. Lenore Coleman, president and founder of Healing Our Village. Welcome to COVID-19 Conversations. This is For Your Health. And we will be doing and airing this series over the next 6 months, actually, because I'm trying to understand what's like really going on with this COVID-19. I have some personal opinions. I've done a lot of the research. And so what we're trying to do here at Healing Our Village is bringing you accurate information, but also sort of letting you know what's happening there in the village, what people are saying on Facebook, social media, what's happening at the dinner table, what's going to be happening over the holidays. And so we're going to be bringing you experts in this area. And also we're going to start videotaping folks, and so they can tell us sort of their conversation, what their opinions are about COVID-19. Is it real? Is it not real? Do vaccines work? Do they not work? Did I take the vaccine? If so, why? And if I'm not going to take the vaccine, why? So today what I thought we'd do is, we are so honored that Dr. Xavier Bryant, kind of showed up at the village, here at Village Broadcasting. And so I said, hey, listen, I need to get you on. We're streaming live. We're going to have this conversation because Dr. Bryant has been in the trenches, actually not only doing vaccinations, but doing COVID-19 testing since this thing started last year. So, Dr. Bryant, thanks. Thank you so much for coming.
Thank you for having me. Thank you for having me.
All right. So we were talking a lot about just your impressions of what you think's going on with COVID. And so I just wanted you to just talk to the audience a little bit about what you said before we started is people don't understand viruses and people don't understand what vaccinations do. So I thought we could but before we do that, tell them who you are and what you're doing.
All right. My name is Dr. Xavier Bryant. I'm a consultant pharmacist and pharmacy entrepreneur. Currently owner of RxMTM Consultants, LLC, where we have orchestrated thousands of COVID clinics where we've performed thousands of the vaccinations, we've performed thousands of tests, and we have our own understanding of how this particular virus has affected our communities as African Americans, and ultimately we just want to provide information, provide data, provide an understanding on the ins and outs, the beliefs, the non-beliefs, and debunk some of the myths surrounding becoming vaccinated, and also creating that space for those individuals who aren't vaccinated to voice their opinion, to state why they feel as though they don't want to be vaccinated or why it's not for them, and ultimately just coming together as a communal approach so that we're all protected at the same time.
Yeah, so you were saying earlier that this whole idea of sort of herd immunity or this being a global actually issue is a problem in terms
Indeed.
of this COVID going away, right?
Right. So when you look at it from a global scale, there's a personal connotation and there's a communal connotation. So as an individual, you can become a host. As an individual, you can contract the virus, you can express the virus, or you can be have a non-expression. So ultimately, becoming vaccinated is for the greater good of society. We have a lot of different opinions, a lot of different subpar understandings on how vaccinations work, on how virus works, on and I mean, and every person who doesn't want to get vaccinated or who hasn't gotten vaccinated, I think it's imperative that we listen to their opinions, listen to why, so that we can actually understand how to circumvent those understandings to make them understand. As a collective, this is for the greater good. But at the end of the day, you still have to respect any individual's opinion when it comes to why they wouldn't want to get vaccinated in this society, knowing the history of America when it comes to when it comes to medical apartheid, when it comes to African Americans and people of color receiving the proper treatment, whether you're being hospitalized, whether you're being vaccinated, whether you're being tested upon, all of those ideas still have to be considered. There's no space in history right now for us to shun away anyone based on their opinion. Listen so that we can come together collectively so that we can come up with the best solution so that we can all move forward within this particular paradigm.
Yeah. Now, so you said something that was interesting. You said when this stuff first started, you're a scientist, you're a pharmacist. We spend a lot of time. This is what we do. It's medications, vaccines, how it works in the human body. This is what we're trained. And you said initially, you were a little hesitant.
Yep.
You weren't sure about this whole emergency use thing. And so, but you said that there was a journey. Just talk a little bit about what that looked like.
Yeah, it was absolutely a journey. So as a company, like I've stated, we've consistently tested individuals from March 2019 all the way up until now. The vaccination became available around the beginning of December 2020.
Right.
And now it's in full effect in 2021 July. As a scientist, I use the scientific method to understand. I observe, I test, I'm hypothesizing, I'm looking at the different parameters to make sure that me as a person understands this medication. Now, true enough, there have been several medications rushed to market. That's why litigation in pharmacy is so huge right now,
Right.
because things are rushed too quickly. Sometimes information is hidden, sometimes information isn't revealed to the public until after the fact, once a person ends up with prostate cancer or some other type of disease state because of taking a medication.
Right.
And now these medications, whether it's Actose, whether it's whatever medicine that has caused a high litigation process, they were produced and tested for years.
Yeah, they were.
Now the mRNA, this vaccine protocol, it's been around for over 20 years.
Yeah, it's not new.
It's not new at all.
No.
mRNA is a very fragile compound, whether you shake it fast, whether you heat component, whatever the case may be. So once it enters the body, it breaks down very quickly. A lot of individuals don't understand that and feel as though that they're going to receive something from this particular mRNA vaccine, but the mRNA attaches to the ribosomes, it makes the spike proteins, and ultimately your body is just looking at the spike protein as an antigen.
Right.
That's how it works.
Right.
But society doesn't understand that as a whole and feels as though, why are they rushing something to the market so fast? Why is it free everywhere?
Right.
Why is it available to everyone? Why all of a sudden we have a vaccine for a disease that just popped up supposedly, and now there's a cure for it and it's free to the entire world when we've had HIV and all other types of viruses available for so long with no vaccination?
Exactly.
You see what I'm saying?
Yeah.
So it makes individuals sketchy. It makes them question. But then you have to go back to primary data. You have to go back to the CDC, you have to understand, and you have to understand who's actually producing the sources that you're reading.
Right.
You know?
Right.
I remember learning in pharmacy school, you have to understand who's producing what you're reading. So I typically don't even read the studies when it comes from Pfizer, when it comes from the companies that are actually administering the vaccinations.
Exactly.
Because ultimately that inherently can be skewed.
Yeah, it could be.
So-
Because they have an interest in you using their medication. So that's
Right.
not necessarily your most trusted source.
That's not your most
as a
trusted source.
scientist. We
Right.
don't read those journals.
So
Yeah.
so it's imperative that you do your research to find the sources to make you feel comfortable.
Right.
To make you feel comfortable. But a lot of people don't even understand how to read a scientific journal.
Yeah.
You know what I'm saying?
It's complicated.
It's very complicated.
And listen, I've been doing this. I used to do clinical trials. I do a lot of, diabetes is my specialty, as you all know out there, diabetes and hypertension. But so when I started reading this vaccine literature, this stuff was, this stuff is deep.
Yeah.
In terms of how the mechanism works, all of the immunology and the physiology changes and the DNA and genetics. I mean, this thing was really complicated.
True.
So when you're trying to get your sources of information about something from Facebook
Yeah.
or Instagram or TikTok, there's no way that any of that information that you're getting should be trusted information.
True.
You need to go to people who are skilled and knowledgeable, spent their life doing this work.
Right.
And they're the ones that are doing the studies and doing the publications, right?
Right.
Yeah.
And those of us who are doing the studies, doing the publications, actually disseminating the information, we have to be patient with those who don't understand.
Yes.
Because there's a group of us, because we understand, because we know, we will grow agitated trying to convince the masses.
Right.
And what I'm teaching my colleagues is to have a level of patience, a level of understanding, a level of grace and space to reach those individuals who are carrying that Delta variant,
Right.
who's spreading it around because they don't understand, and we've shut down as scientists because we're tired of convincing a population that is hell-bent on being some form of ignorance.
Right.
It's on us to shed the light.
Yeah, we got to shed the light.
It's on us to shed
And
the
we
light.
need to try to figure out, so what I'm saying to you, it's not getting you. So I got to not change you, but I got to change what I'm saying to you.
Exactly.
Because at some point, you are going to have an aha moment. I'm going to say something to you, and you're going to say, wow. Okay, because I know that's true, because I've had people who were absolutely against the vaccination.
Right.
And then I talked to them a month or 2 weeks later or whatever, and I said, and then you've gotten the vaccine. I said, well, I thought you said you weren't going to do it. Well, they said, well, Doc, you said something to me, that I had to think about. And what you said was X. Whatever it was, I don't know, because I say different things all the time.
Yeah.
But whatever it was, it got them thinking.
Yeah,
It
absolutely.
got them thinking. And so
Absolutely.
they decided that maybe, when you think about this whole thing, it's probably better to do it than not do it.
Right.
Right? Now you have done, you said thousands of these various vaccine clinics.
Oh, yeah.
Tell us what side effects you really see after the vaccine. Because people
Okay.
are there waiting for 15, 20 minutes after they get it, right?
Okay. So what I typically see after doing these tests and having my own understanding of what the side effect profile will actually appear as, I've witnessed, out of probably about 2% of the population that I've actually vaccinated, there'll be some arm tingling, there'll be some numbness, some dizziness, some lethargy immediately after the first shot.
That's tiredness, folks.
That's tiredness. Exactly. But ultimately,
scientist.
the vast majority of individuals, there are no side effects at all.
None.
There are no side effects at all.
Yeah.
So, but that's not to say that side effects can't occur
That's right.
in that 1% of millions of individuals.
Exactly.
It's true, and it does occur. And I've seen one individual, one young man, where we had to report this to the CDC. He actually ended up with optic neuritis, and the way how I caught this is the hospital they prescribed a dose of steroid that was so high, I automatically knew that we was going to send the child into some type of adrenal syndrome, some Cushing syndrome, something, because the steroid was extremely high. But it was because of a side effect of the actual vaccination.
Right.
So it occurred to him, but when it comes to the vast majority of individuals in the greater whole, it doesn't occur.
No.
It doesn't occur. So I'm not going to sit here and spoon feed and say that, you know what, it's all peaches and cream.
No, it's not.
Eat this sugar, everything's sweet. No, you have your own decision, but you have to get the proper information from the right resources, from credible resources such as you and I, so that you can make a very informed decision.
Right.
Because ultimately, you don't want to carry the variant and harm one of your family members.
That's it. You're going to feel bad now.
You're going to feel bad.
You're going to feel bad.
You know what I'm saying? And it truly affects African Americans. It affects melanated individuals. There are a number of different correlations, there are a number of different causalities, but at the end of the day, it's an individual approach for a communal effect.
Yeah, so diabetes and cardiovascular disease is my thing. So let me tell you some of the stuff that I've learned over the last 3 to 4 months. So, diabetes and cardiovascular disease and obesity all cause inflammation. They are inflammatory diseases. People don't think of it. When you think of inflammation, you think about arthritis, right? But these diseases actually set up inflammation in your body. If you have cardiovascular disease like hypertension, then what they're finding is that people who got COVID had a whole lot of things going on in terms of clotting.
Right.
And they were throwing clots. It's called thromboembolisms. And that's a lot of those folks in the ICU had diabetes, cardiovascular disease, obesity, because of the inflammation, because of those comorbid conditions is what they call them.
That's right.
Right? But also their immune systems were compromised.
Right.
Those diseases, if you have them and you're not getting them under control, it affects your ability of your body to fight infection. That is why people with diabetes sometimes get amputations, because they get infections and their bodies are not able to fight the infection because of immune systems being compromised. So when we talk to you about the fact that a lot of the people who died from COVID, over 600,000 of them, a lot of those folks were African Americans or people with melanin. I like the way you said that. So we're talking about people who of color were the ones that were really affected with the bad parts of COVID-19.
Right.
Now, this Delta variant is supposedly to be more contagious. We don't know about, is it more lethal? They're still kind of figuring that whole thing out, right? But there's supposed to be, when I asked you about now there's supposed to be a Lambda variant, you said we were going to do the whole Greek alphabet.
The whole Greek alphabet.
Right?
I mean, anything is possible right about now.
Yeah.
But there's also the possibility of herd immunity, of individuals who are actually accepting the idea of inoculation. I just ultimately think that as a culture, as a society, in order to get back to where we were, or get back to a better society where we're healthier, where we're washing our hands consistently, where we are just increasing our health and being aware of why we get sick and how we get sick and how to stay healthier. And for those individuals with those comorbid conditions, obesity, hypertension, diabetes, maybe this is a wake-up call.
Yeah, maybe it is.
Maybe this is an understanding of, you know what, because of COVID, I'm going to correct, if not all, at least some of these conditions that I've been living with morbidly for years, and change my life.
Yeah.
Change my lifestyle, change my life patterns, change you can change a whole paradigm for your family if you decide to take care of yourself. So at the end of the day, there's a number of different lessons to learn from COVID-19, where it's not just about getting tested, it's not just about getting vaccinated, but it's really about being aware of your numbers, being aware of your health care, being aware of your blood pressure numbers, your diastolic, systolic, being aware of your diabetes, whether it's your blood sugar numbers in the morning, throughout the afternoon, your A1Cs, being aware of your BMI, just keeping yourself in homeostasis where you can provide the best life for yourself and all those around you. So there are several different lessons to learn from COVID-19, but ultimately, I think what we should take away is how, when, where, and why you should be taking care of yourself as a human being.
Exactly, exactly. Now listen, you just dropped by to say hi to me, and I
That's
didn't
it.
talk you into doing this thing on live and streaming. But listen, this man right here is one of the most amazing pharmacists I've met since I've been here in Georgia, and he's going to come back. And
I'll be
actually,
back, definitely.
I've talked him into doing some For Your Health. So
Y'all see me.
whenever you guys need to turn on your notifications, because when it pops up that Healing Our Village is coming to you live, you need to stop what you're doing. And you need to listen to what we're talking about. Because you can believe I'm not up here talking about stuff just because I need to talk about stuff.
Yeah.
All right? It's important. And over the next 6 months, we're really going to be focusing on COVID-19 because I need to try to get us to herd immunity. Here in Clayton County, which is where I'm at, I'm in Jonesboro. Clayton County's at about 9 to 12% vaccinated. Georgia's in the high 30s.
Yeah, 37.
Okay, herd immunity, people, is in the 70, 80s. So we got a long way to go.
Indeed.
And so we want to try to encourage as many of you out there as possible to get this vaccination. If you don't know if you should or not, call us 800-788-0941. Go to our website, hovhealth.com. Also our tlc-global.org, our Total Lifestyle Change website is going to have a whole COVID-19 page with all of these videos available. So again, thanks for tuning in to For Your Health. We usually stream every Saturday. We do our Sugar Busters from 11 to 12, which is my diabetes program. And then For Your Health usually kicks in right around 1 o'clock in the afternoon on Saturdays. So thanks again for tuning in. We really appreciate it. Thanks for, twisting your arm, huh?
I know.
To get on camera.
No,
But
this
you
is-
the man. You the man.
It's an easy one. We can do this.
All right. Thanks, guys. Take care.